All right, good morning, and welcome to the Kansas City Quality Value and Innovation Consortium Forum. Our vision for KCQVIC is to bring multiple stakeholders together to improve the quality and value of healthcare. We are supported by our partners, BioNexus KC, UMKC NextGen, and KU Frontiers Clinical and Translational Science Institute. And we really are working towards addressing the quadruple aim in Kansas City, achieving better health outcomes, better patient experience at lower costs, and creating better provider experiences with patients and populations at the heart of it. To do this, we're helping create a learning healthcare community where we have healthcare leaders and providers, community-based organizations, researchers, industry, philanthropy, public health, policymakers, and payers and purchasers all at the table with patients and the community at the heart of this effort. Our activities to date have centered around three key activities. First are our regional quality improvement projects. KC EPIC is our opioid project. Through a partnership with the Missouri Hospital Association, the Kansas City Engaging Patients in Care Coordination focuses on peer support and treatment referrals to address opioid use disorders in the emergency department. To support the region in implementing and measuring the success of KC EPIC, KCQVIC established an interdisciplinary interinstitutional team to support local hospitals and customize interventions to meet the needs and better predict success. Our second project is our Transitions of Care for Heart Failure project, which focuses on addressing social determinants of health. Hospitals and other stakeholders are struggling with how to improve the transition from inpatient to outpatient settings for heart failure patients. Through interviews with multiple hospitals and outreach to national organizations, we have identified a number of potential strategies, and our partner hospitals are able to choose from those, and we help with the implementation of those strategies. Next, we develop the training and implementation actionable research approaches and are looking for additional ways to educate investigators, quality improvement personnel, and others about implementation and the methods behind it. And finally, why you are all here today is our forum. It's a strategy to engage our communities and stakeholders through the dissemination of information that is important to you and provided by members of our community. This is a look at where we have been and where we are going with our forum. Today, we are focusing on compassion fatigue and employee wellness. And then in October, we're looking at novel social determinants of health approaches and their impacts. Thank you for joining us at a kind of unique time for us. And then in October, we will resume to our normal time on a Thursday from 3 to 4:30. We have an excellent lineup today of speakers. We will be hearing from Melody Elston, and she will be giving us an advocacy and long-term care perspective. Shayla Sullivan will be providing a research perspective. Dr. Karen Florio will be providing a provider perspective, and Dr. Ravidan Sabathy will be providing a health system perspective. We will have our question and discussion session at the very end, but please feel free to put any questions or comments in the chat box, and our presenters will address those throughout, just in case we are not able to get to them at the end, and that will be facilitated by Dr. Stacey Farr. So our topic today is compassion fatigue and employee wellness. Compassion fatigue is a term that describes the physical, emotional, and psychological impact of helping others, often through experiences of stress or trauma. Compassion fatigue is often mistaken for burnout, which is a cumulative sense of fatigue or dissatisfaction. While burnout is one part of this form of fatigue, the term compassion fatigue encompasses a more specific experience, which may be brought about by a stressful workplace or environment, lack of resources, or excessive hours. This form of fatigue is sometimes called secondary stress reaction, secondhand shock, secondary traumatic stress, or vicarious trauma, likely because of compassion fatigue's link to careers and positions that may regularly place you in stressful situations. This is very common, unfortunately, right now during the pandemic. Compassion fatigue impacts a wide range of caregivers and professions and is most common among professionals who work in healing or helping capacities. Next, we will hear from Melody Elston, who is the Regional Omnibus Fund Program Director from MARC in their Aging and Adult Services. Welcome, Melody.
Good morning. Good morning. I'm so excited about this opportunity, and I am going to share my screen. Can everyone see that well?
Yes, we sure can.
Okay, wonderful. So my name is Melody Elston. I am the Regional Long-Term Care Ombudsman with the Mid-America Regional Council. For those of you who are not familiar with what an ombudsman is, it is an individual who knows the laws, the regulations, and the rights in a certain industry. And so since I'm the long-term care ombudsman, I am the ombudsman for nursing homes, assisted living facilities, and residential care facilities, which are also known as group homes. I'm a social worker by trade. I've worked in many community-based organizations and many type of different demographics. I've worked with people who are homeless, people who were in domestic violence situations. I've worked in skilled nursing homes. I've also worked in community mental health organizations. And right now, as you are aware, I work for MARC as an ombudsman. In all of my experience, I have been an advocate for those who are underserved and vulnerable populations. And since I have the pleasure of opening this forum, I thought it would be helpful to understand the term wellness. So I've come to learn that with my experience that no one person is the same, that we don't have the same needs and we don't have the same values. So wellness will look different to everyone based on their individuality. According to the Substance Abuse and Mental Health Services Administration, wellness is a broad concept that one should consider as being healthy in many dimensions of our lives. So not just one dimension, but all the aspects of our lives. We recognize that we live in a multicultural world, and wellness encompasses areas that may not be specified in this discussion. Trauma is universal. It's a universal human experience, and our culture and spiritual beliefs impact our perceptions and everything that we do. In summary, wellness is about how we live our lives and the joy and fulfillment and health we experience as whole individuals. So according to SAMHSA, there are 8 elements of wellness. There's emotional, spiritual, intellectual, physical, environmental, financial, social, and occupational. And so that's kind of what we're touching on today. Here's a little example of how all of those things could be intertwined. We may worry about money, for example, being in debt or being able to afford what we need, the financial. We sometimes experience anxiety because of that, which would be the emotional. This could lead to medical problems, the physical, trouble at work, occupational. So when this happens, we may even question our own sense of meaning and purpose, the spiritual. At the same time, when we're not working, which would be occupational, we may lose opportunities to interact with others, which would be the social. And they may not be able to afford the good food, medical care that we would need. So that's physical, financial, and medical, to say well, which would be physical. We may even need to move our home to a place that feels less secure and safe, and that would be the environmental portion. So one slight change can throw off the entire balance. Since this forum is about wellness and how compassion fatigue can affect it, we'll dive a little bit deeper into occupational wellness. Occupational wellness involves participating in activities that provide meaning and purpose and reflect our personal values, interests, and beliefs, including employment, volunteering, and caretaking of those that we love. So it's not just limited to employment, but in all aspects of our life where we find meaning in work. For discussion purposes, I'd like to share about who I'm referring to when I speak about an advocate. This is not the formal definition, but it's to be applied in this context of the information that's being presented. So what is an advocate? An advocate are those people who serve vulnerable and underserved in any capacity. Those who work on the front lines, like social workers, people who may work in pantries or volunteer in any type of not-for-profit or agencies or organizations, all the way to those who ensure services are provided to community-based organizations like directors of programs and even administrative assistants. So the advocates we're speaking of are not necessarily social workers or necessarily the front lines, but anyone who takes their time and puts their energy towards serving others. I wanted to share a little bit of my experience with advocacy and wellness. As I mentioned earlier, I have an extensive social work background. And so when I started my career right out of college, I worked in the child welfare for the Children's Division. Many of you are familiar with the reputation of child welfare workers. And so I'm sure that this example may resonate with some of you. I worked there for 5 years, which I'm proud of. But in my training class, I was told that most of the people there would not be able to last for 1 year. Me being the type of person I am, I don't like to be underestimated. I perceive this as a challenge. So I told myself that I will be the person that lasts there for at least a year. Of course, the reputation is that child welfare workers have large caseloads, we're understaffed, and in my opinion, also undertrained. And so with the goals usually being reuniting families, I saw reunification, but it was like it was less than it really was supposed to happen. So me being overwhelmed, overworked, undertrained, I told myself that I could beat this, that I could win at this. And I told myself I was going to catch up with all my work. I worked more. That's how I did it. I was already overwhelmed, but I decided how to fix my solution was going to be to work more. I would come in at 6:30 in the morning and I would leave close to probably 8 p.m. at night. So I was adding more time to my days. I did not have a family at that moment, but so I felt like I could focus on doing the best that I could, and that was going to be to work more. I started in April, and then by December, I found myself in bed with the flu. I was 23 years old. I had never had the flu before, and I'm 37 now, and I haven't had the flu since. So at that moment in time, although I didn't have much hindsight or foresight, I knew that the reason I was in bed is because, and I had the flu was because I had just my body was stopping me. I had completely shut down. And then I realized I had to do something different. I wasn't going to quit because as you know, it was December and I started in April and it hadn't been a year. So I decided that I needed to do something different for me. What did I do? I implemented balance. So as we mentioned, the eight elements of wellness, I unknowingly reincorporated those 8 elements back into my life. I started packing my lunch, which was physical. My diet had severely been affected because I was always in my car, going to court, going to the office, going to the children's homes. And so I decided I was going to stop eating fast food. And so I had started packing my lunch. I started socializing with my friends more. If they invited me to lunch, I would go to lunch. If they invited me out after work, I would go. And even though those were very small moments, they took some of the stress off of where my mind was. I stopped skipping church. I had been skipping church for work, so I incorporated the spiritual back in my life. And my environment was no longer the office, family court, and my car. Now, for my long-term care ombudsman role, many of you are familiar with the major changes that the pandemic has caused in our work lives. And prior to the pandemic, I would receive calls from residents, their family members. I would meet with individuals in the facilities to investigate whatever complaints, and I would be able to get them resolved fairly timely. I found pride and accomplishment in the fact that I was able to help and get answers and resolve concerns, not just with the facilities, but also advocating for residents with concerns that they may have with their families. If I was unable to get a response from the facility, I would just get up from my desk and I would go to the facility and I would get the issue resolved because I had the ability to do that. Challenges that impacted my ability to effectively advocate in this manner during COVID were, number one, the changes that were implemented in regulatory practices, which I believe infringed on residents' rights. One being residents being unable to leave facilities and being confined to their rooms. We all know that it was frowned upon to socialize at the beginning of the pandemic, but ultimately we still had that right to do that, whereas residents in long-term care would be threatened to be evicted if they had left their room in some cases and left the facility to socialize. There was also the inability to go into long-term care facilities. The ombudsman is federally mandated to be allowed into long-term care facilities at any time. And so with that being said, when the shutdown happened, only surveyors, employees and surveyors were allowed in long-term care facilities. And surveyors could only go to investigate infection control practices or imminent danger. So a lot of things impacted my work. I took many complaints and it took days and weeks to resolve due to the decreased responsiveness from facilities. Sometimes they just wouldn't respond to my emails and answer phones. And it had a lot to do with staffing shortages, but also the lack of accountability because there was no one that could go into the facilities. I would receive calls where families had difficulty reaching facilities for virtual visitation and compassionate visits, which were considered end-of-life visits. And these visits were not upheld. The impact it had on me as an advocate was taking its toll, and I began to experience secondary trauma because I would hear stories of people losing their loved ones without being able to say goodbye. I also had to listen to complaints knowing there was nothing that I could do about it. And I experienced verbal abuse from callers expressing their disappointment and their disdain by my inability to intervene or assist due to the recent changes that had rolled out through regulations for long-term care facilities. Okay, so since we're talking about wellness, I'll share a little bit how I handled these challenges as I recognized that I was experiencing these symptoms of secondary trauma, compassion fatigue, burnout, because I was no longer receiving reward for my work. And the rewards were thank you, it was getting things accomplished. I'd like to share a book that I read that changed my life. And I'll, if you know me, I'll have like posters and I'll have them everywhere to remind me. And it's called The 4 Agreements by Don Ruiz. The 4 Agreements discuss sources of self-limited beliefs that rob us of our joy and create needless suffering. It's based on ancient Toltec wisdom. And so it's basically a code of conduct where they say that if you go by these rules, it will alter and change the way you think in your life. So the agreement that I applied to that part in my life was the 4th agreement, and it was always do your best. Under any circumstances, always do your best. No more, no less. But keep in mind that your best is never going to be the same from one moment to the next. Everything is alive and changing all the time. So your best will sometimes be high quality and other times it may not be as good. When you wake up refreshed and energized in the morning, your best will be better than when you are tired at night. Your best will be different when you're healthy as opposed to sick. It will depend on whether you are feeling wonderful and happy or angry and upset. In your everyday moods, your best can change from one moment to another, from 1 hour to the next, from one day to another. Your best will also change over time, but keep doing your best. No more and no less than your best. If you try too hard to do more than your best, you will spend more energy that's needed. And in the end, your best will not be enough. When you overdo it, you deplete your body and go against yourself. It will take you longer to accomplish your goal. So I was sitting at my computer, feeling defeated after ending a phone call with a man whose daughter had passed away in long-term care during the pandemic. And he was unable to say goodbye to her due to the restrictions he was unable to say goodbye to her due to the restrictions that were being held as far as the facilities being locked down. And he believed that they neglected her symptoms while they were locked down. But the purpose of this man's call was not to get anything resolved, but to inform me of his daughter's death. And in that, thanking me for the work that I had helped him with in the past to get her the help that she needed. He told me that he would never forget what I had done and that he would have been lost in a time where he was just trying to make sure his daughter was okay. Despite this being a call of appreciation, I was almost broken at the news of her death, and believed cause because I believed it was, neglected symptoms as well. I couldn't really hear or appreciate the thank you that I was getting because I focused on what I was unable to do and had not been able to do. The opposite of the reason for his call. So I was sitting there feeling sorry for myself, feeling sorry for this man, feeling sorry for the situation that I'm kind of self-pity because I couldn't help, I couldn't advocate. And then I realized, I sat there and realized that this man was not having the same mindset that I had. I did my best and he recognized that. So I began to sit in that gratitude that he expressed to me. And I had peace and understanding that in the role of an advocate, sometimes you can't save anyone, but you do recognize that you do your best. In conclusion, the Substance Abuse and Mental Health Services Administration offers ways to improve our wellness and advocacy, and that is to ensure that we incorporate these 3 areas: our work relationships, incorporating balance, and accomplishments. So our work, it should be meaningful. It should be something that we take pride in doing. I always say, my mother used to say, you need everybody. It takes everybody. And so she always taught us that no one was better than anyone and that it takes us all to make things work. So making sure that we are involved in something that provides value and purpose. Balancing, looking at the 8 dimensions, going to lunch, taking those short breaks for yourself, and also accomplishment by also always doing our best and sitting in our thank yous, sitting in the appreciation and the things that we accomplish. I appreciate this time and thank you.
Thank you so much, Melody. And this has been just amazing. I know I need to purchase a copy of that book, but I really relate to the piece about sitting in those thank yous, because I think oftentimes I myself find myself just brushing those off and not really taking those to heart. And they make a difference, right? They
absolutely do.
So thank you so much. Next, we have Dr. Shayla Sullivan. She is a child and adolescent psychiatrist in the Department of Developmental and Behavioral Sciences at Children's Mercy of Kansas City. She's also an associate professor of pediatrics at UMKC School of Medicine. Welcome, Dr. Sullivan.
Thank you. Can you guys see my slides okay?
Yes, we sure can.
Awesome. Okay. Well, I have to first say, my goodness, that's a hard act to follow, Melody. That was really great. And I appreciate that you and Christina both gave definitions, because I'm not going to spend time on that part today. I was honored to be invited. I think this is a really important topic, and it's something I spend quite a bit of time on with my trainees. So a big part of my role at Children's Mercy is teaching future pediatricians, child psychiatrists, medical students who are not sure what they want to do yet. And I think that talking with them about finding some balance is really important. I cannot say that I represent all researchers today. So if you're a researcher watching, you might say, well, her work is very different than the typical researcher. And I totally am aware, and I agree with that. But I'm going to talk about some real world examples from my life about setting boundaries and how that's been really important for me to do that, to be happy in my work in medicine. And some components of support that have made that possible for me. I think this is not something that we do in isolation. We do this with each other. So I practice at our Adele Hall location downtown, where I see patients. That's where I had a very full day of clinic yesterday. And then I'm also today at College Boulevard, where I'm in the Eating Disorder Center. So I spend about half of my time with patients, and then the rest of my time is focused on my research. So here are those definitions that I started reading about, and I decided, actually, I'm going to focus more on some real basic concepts today that I think are very much related. And I think it's this concept of how can we be okay while doing this really difficult work. And I will acknowledge that in my life, the scales are almost never perfectly balanced like this. But I think we have to continually be mindful of how do we seek out that balance. So I do focus on youth suicide prevention in my research, and I want to just give you a quick couple of reasons why I would invite you to join me in this. It is Suicide Prevention Week and Suicide Prevention Month, and we have a lot of work to be done here in the metropolitan area, in our region, in fact. What we know is that youth firearm suicides have increased dramatically, 60% in recent years, and only 18% are receiving mental health treatment at the time that they die. And that is really mind-boggling for me, even as someone who focuses my work in this area. Nationally, suicide deaths for young people have gone up 57%, but that is not even, it's worse for us. So in Kansas, it's been 60%, and in Missouri, 71%. So really kind of appalling. But there is some low-hanging fruit in terms of changes we could be working on to make this better. Now, those pieces of data are from pre-pandemic, right? And so we are starting to learn some concerning news about the pandemic. What we know is that in the spring of 2020, more young people were presenting to emergency departments for suspected suicide attempts. And when I talk to my ER colleagues, I know that they have been extremely busy with this. And then if you look at pre-pandemic compared to this past spring, 2021, what we see is a 50% increase in young girls presenting with suicide attempts. So we have a tremendous amount of work to be done. I share this not to freak you out, but to get you motivated that, yes, this is really something we need to work on. So prior years before the pandemic, I developed this presentation for parents. It's called Prepped and Ready, Parenting into the Teen Years. We talk about lots of topics related to parenting, including vaping, eating disorder prevention, but the big focus is on suicide prevention, what we as caregivers, people raising young people, can do. How do you talk about suicide with young people? And what are the physical changes you can make within your home that could prevent a death by suicide? So in the research, we give out lockable medication storage boxes to help people safely store medications. We give out a cable gun lock from the Lock It for Love program, who have partnered with us. And we measure changes. We measure how many people actually throw out their medications after they see the presentation, how many lock up their guns. And we're very excited. We've had 5 times as many people report that they've safely stored their firearms after the presentation. So I was doing all these live in-person presentations as a researcher and did not realize how much I thrive on that group dynamic, right? I like to present to a room full of people. I like the energy from the room. I like the questions and the interaction. And so this is how we started out. Pandemic hit, like every other researcher, you pause and you think, what am I going to do? How can I continue my work? I was one of the lucky ones. So many labs just shut down, right? Screeching halt because they could not continue their work. I could go to the IRB and say, hey, can I give webinars instead? So I transitioned my presentation. So this is me giving one of my webinars. And if you see that look in my eye, right, that not so excited look, that's my eyeballs looking to the top of the screen, the number of people that have joined the Zoom call, right? It is so different to do work in this way. And it's wonderful that we have this opportunity. I'm so glad I didn't have to shut down, but I have realized how much harder it is and less fulfilling in some ways to do my research in this way. But of course, we just have to adjust because that's what researchers do. Now, a couple of examples of negotiating balance in my life. When I was in my training at KU, I had the opportunity to go to the Beck Depression Institute in Philadelphia and sit in on their staffings, and I was so excited. And I remember talking to one of my mentors at the time, Dr. Dividinum, and I said, hey, I'm afraid that for my clinic that day, since I'll be gone, they're going to put all my patients on my colleagues' schedules. And I don't think that's fair. They're just going to have to work really late that night. And he said to me, so you're thinking of not going because of that? And I said, well, I want to be a team player. And he said, Shayla, if you don't learn how to take care of yourself in this field, you're going to be in trouble because there is an endless amount of work. Not only do you have to take care of yourselves, but your colleagues are going to have to figure that out. And that was really instructive for me because he is a very strong clinician, a wonderful mentor, and a really good team player. But that's what I have really taken from a lot of my mentors over the years. You work really hard and you are committed to your work, and you have to have limits or else you're not going to do well. So here's a blurred out example of a Cerner schedule from a time where my father was having an oncology appointment. And I had planned to attend that with my parents. I wanted to hear about his prognosis and plan of care. And Then, of course, you get the phone call. The doctor's office has moved the appointment to smack dab in the middle of a very busy clinic schedule for me. And I didn't like to cancel or move patients. That's just not something that I do very often. And I recall my assistant at the time coming in, and she saw I was trying to figure this out and wondering, how could I make this work? And she just said to me, you know, I think I'm going to go ahead and call those people and reschedule them for you. And it'll be okay. We'll deal with it. I'll have your colleagues cover if there's any emergencies, but I think you need to go to that appointment. And I'll tell you, that was so helpful because I was having trouble at the time negotiating that my commitment to my family needed to override my commitment to my patients in that moment. And of course, I have lovely colleagues that are willing to take over. We cover for each other in those situations. And then finally, this is one I can laugh about now, but many years ago, I missed a deadline at the hospital where you had to report how much time you spent in clinical work and administrative time, teaching time. It takes about 30 seconds to do this form, but I had forgotten it. Because I was so busy helping implement our universal suicide screening program, I had been working lots of overtime. My boss had actually asked if I could be paid more because I was working extra. And so the hammer came down, no, we can't make exceptions. Everyone has to fill out this form. And I was upset at the time. I was very upset they didn't make an exception. But it was an important lesson for me to remember that you have to take good care of yourself and you can't work so hard that you're not doing that. So I've never missed that deadline again, I will tell you, and neither have any of my colleagues. I make sure we're all on top of it. So a couple of pictures here. This one of my father with the dead turkey and his camouflage is one I often show in my presentations for parents because I want to emphasize that my focus is not anti-gun. It's about safe storage with firearms and my understanding that firearms are a part of our community. I grew up with a dad that hunted. He had very limited success over the years, but big smile in this picture because this was the day he got a turkey and had success. And it's a big family story. The turkey actually started to attack him and it was really crazy. So he came to show my daughter, who's now 13. And then here's a picture of us, of course, at Christmas holidays. So very close family. He's been a huge guide in my life over the years. In June of 2019, he was placed on hospice. And it was a good decision. He lived a very full life and he was done with spending time in hospitals and he wanted to live his final time at home, spending time with family and doing things he wanted to do. At the very same time, we had worked very hard to implement our suicide screening program. And I was encouraged to author this paper. And I remember saying to my supervisor, gosh, this just is not the right time for me to take on a big project like this. But I had been the main one with the project throughout. It made sense for me to lead it. And she reminded me that this is a group effort when you write a big paper like this. This is not something you do by yourself. So we divided it up and we got started on it. She also reminded me that good colleagues understand when things have to go on hold. We had just had a colleague lose his daughter. And she reminded me that when that happens, things go on hold and people get it. So we proceeded with it, and this paper was just finally published in August. But it was a good reminder for me that sometimes you have to strike that balance. You know, my dad didn't want me to just quit working and hold vigil at the house all the time. He was actually had a pretty good quality of life. He was pretty busy. So, and then I think this paper is the reason why I was probably invited to speak with you all today. So years ago, I was invited to help write in this ethics rounds for pediatrics about a doctor who was experiencing burnout in the ICU. And as I read the story, I was supposed to comment as a psychiatrist on what I thought should happen next. And I realized in reading it that I had my own very clear experience of trauma in my past that could have led to a really bad outcome and didn't. And I felt compelled to share that story. So, and I will acknowledge, I don't usually talk in big presentations about this much personal stuff, but I think it's really important for this topic. So my brother was 29 years old, and the weekend of Memorial Day weekend, he had what we thought was a virus, but his blood pressure was fluctuating a lot. It didn't add up. And so we took him to the emergency room and very quickly learned that he had been experiencing cardiac, well, he was having aortic dissection, basically. They finally got a cardiologist in there and he went to surgery and he died overnight. It was awful. It was such a traumatic experience. I was 7 months pregnant. We had not known he was sick, so it was just very abrupt and like nothing I'd ever experienced. And as you're in the process of grieving and trying to figure this out, you also have to respond to work. I had the pager, right? I'd been on consults, and I was supposed to report to the ER the next week and do my ER rotation. And I remember thinking, oh, I don't think I'm ready to be in the ER. I don't think I'm going to make great decisions right now. And so I saw Larry Long, awesome counselor at the counseling center at KU, and he helped me talk through what I needed, that I needed some time to process this. So I took a week of bereavement leave, and then I took my sick leave that I hadn't used that year. And when I went back, they allowed me to modify my hours a little bit. And then I started my fellowship and had my daughter, and it all went well. I was grieving. It was not easy, but it went well. And I think it went well because I took some time, and I had very supportive family. My husband, my friends, my colleagues said, you take the time you need. My supervisor said, what do you need? And I think that's the kind of environment we need. We often hear the bad outcomes, right? The stories of the doctor that totally burned out and made this major error. But I think there are a lot more examples of folks that get support, and there should be. So I try to really take time to talk to my trainees about this, because I think in healthcare, often we are accustomed to putting your head down and working hard, right? You want to be a team player. You do this work because you love it. But we have to remind each other that we are human beings and we have to take good care of ourselves. So setting limits, I think, is critical. We have to remember that we're humans first. And sometimes our personal needs are going to collide with our responsibilities at work. And having those supportive colleagues and supervisors, I think, can make a huge difference. And then finally, I just wanted to put a word in here that the Prepped and Ready presentation has morphed over time. We did live in-person presentations, we did webinars, and what I've come to learn is that many caregivers are so busy, they're never going to have time to sign on to a webinar at 7 p.m. Maybe they're working 2 jobs, and I really want to reach as many people in our area as we can. We've had trouble reaching people of color, we've had trouble reaching men, and we want to reach more firearm owners. So we also have developed now a series of videos that are just 3 to 5 minutes that folks can watch from home whenever it suits them, when they have a couple minutes at a time. The videos cover the same topics, and I've been able to invite different doctors from the hospital to participate. So I'm really excited about this. We will still mail out toolkits for people to implement the recommended changes for people that fill out our research surveys. So if you know anyone that would be interested, please don't hesitate to email us, or just go to your favorite search engine, type in Children's Mercy Prepped and Ready, and we will be releasing our launch date of the videos very soon, hopefully in the next week or so. I'll stop there.
Thank you so much, Dr. Sullivan, for sharing your personal stories. I'm so sorry for your loss. I can't even imagine how difficult that must have been with everything you have going on at that time. One of the things that you had mentioned was about the importance of setting boundaries. And I think that that's very important, particularly at this time when demands for work are high and the workforce is already stretched thin. For those of us who aren't in clinical settings and are working from home, it's hard to sometimes separate those boundaries between work and home because it all exists in the same place now. And I think the importance of having leadership who are really good at modeling what that looks like and encouraging that is very important. So thank you so much for sharing your experiences with us and your research. Next up, we have Dr. Karen Florio, who is a maternal fetal medicine specialist at St. Luke's Hospital of Kansas City. She's also the vice chair of the Missouri Maternal Mortality Board. And she is going to be providing us with a provider perspective. Welcome, Dr. Florio.
Thanks, Christina. Can you guys see my screen where it says provider's perspective? Okay, great. So, I feel like I should have gone first because each one of you gives such a great perspective, and it's so hard to follow that. So As Christine, so thank you very much to all the panelists so far. I've really learned a lot. I want to say thank you for allowing me to come and speak today. I think that this allowed me to dig a little bit deeper into my experiences throughout the last year and a half and some of the decisions that I've made and why I made those decisions. So it was a good self-reflection learning exercise for me as well. So as Christina said, I'm a maternal fetal medicine specialist. And for those of you who don't know what that is a high-risk pregnancy specialist. So I was asked today to give some perspective throughout the last year on compassion fatigue. And thinking about this, I have to say, I didn't realize that I was experiencing this until recently. And I'm going to give you a story on how that kind of came to be. And I kind of had to take a step back and remind myself that I'm here for a purpose and to not let all of these surrounding things affect the way that I'm giving care. And so just to kind of start out, Christina talked a little bit about burnout, and we've been hearing a lot today on burnout, either compassion related burnout or burnout from the job overall. And I think it's important to define burnout so that we can understand exactly what it is that we're talking about, right? So if you were to read studies by the AHRQ, burnout is defined as a long-term stress reaction marked by emotional exhaustion, depersonalization, and a lack of sense of personal accomplishment. And if you think about that, if my 8-year-old, who is the light of my life and the reason that I get up in the morning, if he were to come home and tell me that he was emotionally exhausted, that he was feeling depersonalized and had a lack in the sense of personal accomplishment, but I don't know if 8-year-olds have that, I would shank an 8-year-old for making him feel that way, right? I am not above that. So why is it that we protect the people around us when it comes to burnout, but we don't protect ourselves? And so in reviewing these definitions, I really thought deeply about that. Why do I let that happen to me? But I would never even imagine letting that happen to somebody around me that I love, right? And so in thinking about personal burnout, I think much of what contributes to burnout is systemic, right? It's not a personal flaw. It's a systemic issue that could affect the quality of care of patients, access to care for patients, and even patient satisfaction, because what we bring to the table is what patients see, right? And so I think we need to start seeing this burnout in general as a societal level problem and start treating it as a systemic problem that can be solved through things like teamwork. And teamwork involves the healthcare workforce team, society, and administration, right? And so what I have here on the slide, as you can see, is a study done by the AMA on how burnout affects different specialties. And I think that was what was most striking to me is that if you look at this list, at the very top of the list are the people who are absolutely at the front line of COVID, right? So you got ER physicians. They were already at their peak burnout rate before COVID hit. And then obstetricians, right? We were at the front line as well, delivering women in the height of COVID, because that doesn't stop, right? And I think if you look at the arrows on the people that had increase in burnout, you can see that infectious disease doctors were already start to experiencing burnout before COVID. So imagine what they're feeling now. And so I want to show you this image here. What contributes to burnout in general for physicians? And again, we're talking about prior to COVID. So work conditions such as time pressure, chaotic environments, low control over your work pace, unfavorable organizational culture. These have all been reported to be strongly associated with physicians' feelings of dissatisfaction, stress, burnout, and intent to leave the practice. However, physicians' reactions to these work conditions were not consistently associated in studies that I was reading with the quality of care of patients, which tells you that they are able to be that buffer in between patients and the way that they are feeling. And so they're kind of protecting their patients against what they're seeing at work and all the stresses that they're feeling and still being able to give high quality care. But I think what we're seeing as things continue to weigh on providers is that could take a change for the worse. And so just from my own personal standpoint, I can attest to the very real scenario that has led many of myself and my own colleagues to experience burnout. I think if you poll any number of providers within the healthcare system, every one of them will mention how they are working shorthanded, right? Whether that be ancillary staff, such as schedulers or MAs to help room patients and take vitals, to shortages of providers. I know for my own practice, we've been asking for 5 years for additional doctors due to the overwhelming increase that we've seen in patient volumes. So my practice, we became 4 years ago. And since that time, we've seen over a 50% increase in our patient volumes, which is great, right? However, we cannot continue to do the work of 5 or 6 docs with only 4 people. And that didn't leave us any room for us to take vacations that we wanted to take, to spend time with our families, or to have sick days. I mean, it was sacrosanct. You never called in sick to work, right? And I think if there's anything that good came out of COVID, that was one thing that came out of COVID, is that, hey, if you're sick, right? So one thing I think that contributes significantly, again, we're talking prior to COVID, to burnout is the staff shortages that we're all experiencing. I think all of us have families that we're trying to juggle. You know, during COVID, we were trying to do homeschooling. Prior to COVID, I know for me, I had to juggle taking my kid to his athletic events, taking him to swimming lessons, taking him to language lessons, all on the weekends, while also still trying to juggle work on the weekends, right? So being a working parent is really difficult, because you want to give the time, as Sheila was pointing out, to your patients, but you also really want to give that time to your family, right? I think another thing that contributes to healthcare burnout these days is that I don't think that every person of the team realizes what value they bring to the team. So for instance, the front desk staff is absolutely the face of your practice and the wheels that make the whole production turn, so that patients are scheduled correctly, right? So when patients are scheduled incorrectly, or the front desk staff is understaffed and they don't have enough help, that really puts not only a lot of stress on the patients, but it puts a lot of stress on the physicians, because when you're scheduled incorrectly, then everything gets behind, right? So I think that at least personally for us, has really contributed to problems in the workforce. And then lastly, if you ask any physician what is most important to them, it's time. Not only time at home and the freedom to have control over their own schedule without having to feel like they are some kind of puppet made to dance when administration tells them to dance, or to do this when they tell them, you know, they have to be here after hours. I think that we also value the time that we need with patients. So for me, I feel actually lucky in this sense, because I am not a doc who lives and dies by the RVU. And I can actually spend the time with patients that I need. But if you were to look at multiple studies on physician burnout, one of the things that is reported is that doctors don't feel like they have enough time to spend with their patients. And so how are you supposed to sit with your patient when you have 5 minutes and talk about not only what ails them and what brings them to the office that day, but what are the social determinants of health that are contributing to that, and how can you address that within those 5 minutes? So when I say time, I not only mean the time to control your own schedule and to have time outside of work, but the time that we really value to have with the patients. I think that when you take all of these things, right, and you make a pyramid out of it, one of the things that is incredibly frustrating, I think, for providers and the healthcare workforce is the amount of middle management that we have to deal with. And so, for example, I think that when we think we're communicating to the correct people, it gets lost in the shuffle and never gets to the appropriate higher level of management that can make those kinds of decisions. And so the AMA and the AHQR that did studies on this, again, one of the things that providers report as a dissatisfier is the amount of middle management that people have to deal with. And so because of all this, right, you know, and before COVID, I feel like I'm a very happy-go-lucky kind of person, and I try to keep things upbeat. But before all this, before COVID, you know, I was seriously considering a career as a barista, because you just get so frustrated with the amount of work and time and emotional energy you put into your patients. I could put that into a really good cup of coffee instead, right? So we talk about burnout before COVID, and now COVID hits, right? And we know that COVID has been an emotional roller coaster because of the enormous expectations placed on providers throughout the pandemic. And so if we start from the beginning, it kind of all started with us going off to war, literally to save America. We were now the only ones, or it was perceived, that could get us through this situation. And, you know, you saw the healthcare workforce do that without hesitation. However, we were expected to have compassion and emotionally kind of keep it together as we watch family members be ripped apart by isolation and death, while at the same time, we were not provided with the proper tools to keep ourselves safe. You know, I can very vividly remember coming to the hospital in my PPE as one of the first people to be donned in PPE, right? And to take a step back, as a teenager, I was like super nerdy and loved to read things about pandemics, funny enough. And my obsession was with Ebola. And so I had this really good sense as an obstetrician, strangely enough, on infectious disease. And so when this hit, I kind of started critically thinking like, oh, these are the things that I'm going to need to keep myself safe and keep my family safe, right? And so I very vividly remember coming to the hospital during one of the first weeks. And I think we can all remember when it was a big deal that PPE was in shortage, and that, and I'm not saying my administration, but administration wasn't providing those things. And I was told, don't wear those things in the hospital because you're scaring people, which funny enough, 3 months later, we were wearing that exact thing. So to not be able to think for yourself was very frustrating, right? But in all this, America had a sense about, you know, us being the heroes, and they kind of stood by us and hailed us as heroes as we continued to try to push through this, until it started affecting the economy, right? And Lord knows there is nothing more mighty than the dollar. And so now, on top of all the other baggage that we had to deal with, we were fighting our patients to actually stay home and stay healthy, right? Stay home to keep yourselves healthy, but also stay home to keep us healthy. And so that was really discouraging, because through this, as we were trying to fight through COVID, as we were trying to fight through keeping our families and ourselves safe. And again, the things that I tell my residents is this is an incredible time to be in training, because never again in your entire career will you have all the equipment you could possibly want and none of the knowledge. It was so backwards to the way we were used to practicing medicine, right? And so we were trying to fight through this and trying to keep patients home. And that was really hard. And then you saw people really start to wear down. And I think that Sheila can attest to this, is that this is when we started to see the rates of suicide really go up, because we felt trapped. We were trying to take care of people, but nobody was listening, right? We couldn't get our administrators around to rally around us and listen to what we were saying. And we couldn't get the general public to rally around us and listen to what we were saying, to stay home, because we were fighting an uphill battle. We began to wear down. And then also through this, and I'm lucky in this sense as well, but we started to see healthcare providers, their pay being cut. So we're being asked to do more with less protection, with less support, and for less pay. And so it's no wonder that people are coming to work with what we call compassion fatigue, right? So we began to struggle. And not only because we had to see our patients dying, but now we were fighting them to stay home. And again, this really began to set in. And then the light at the end of the tunnel came, and oh my God, what a glorious day. I remember that morning, it was rolled out that week that the vaccine was here. And it was like a huge sigh of relief, right? Like, we're finally going to get through this. This is going to be okay. We're going to get the shot. And my husband, who doesn't even take the flu shot sometimes, called me at 7 o'clock that morning. He's like, get up here. They're giving out the shots, whoever shows up in line first. And I will tell you, I didn't even brush my teeth. I can't even remember if I put on the proper undergarments that day, but I ran to that hospital and got my shot, because this was our one shot at getting out of this, right? And so that is actually a picture of me with my first vaccine. And then it got better for a little bit, right? We were not excited to come to work, but it was getting better, right? I didn't have to get naked in my garage before I came in the house to try to protect my family, because now I'm protected with the vaccine, right? And we saw that the general public was starting to jump on board with this, that they were also getting vaccinated. It was the older population. And we saw the rates of vaccine going up and the rates of infection going down. And then came the conspiracy theories. And for people who spend, well, in my case, 18 years of higher education, believing and learning about the science of vaccines, for those of us to see this happen, just became a major gut punch, right? To see people consume their healthcare information from Facebook and Twitter rather than their own providers was like watching an entire society drink the proverbial Kool-Aid, right? And so that's when it really became, for me, compassion fatigue, right? This is when I think we all became really disenchanted with the American public, with our faith in their fellow man to love thy neighbor. I mean, how could it be that an entire healthcare workforce lined up, first in line, volunteered to take that shot, knowing full well the science behind it, yet those who were literally dying from this were continuing to choose to roll the dice? It boggles the mind and is emotionally draining. And I think the compassion fatigue that we see now is real, and I see it every day. You know, I will just give you an example of real life experience for me, and then I'll quickly finish up here, is that I had to literally fight a pregnant patient in the ICU who, even while she was being intubated, continued to believe that she did not have COVID, to the point where she woke up and her baby was then out of her, right? So to miss all of those moments and still believe you didn't have COVID, I mean, what kind of programming does that take? And it becomes exhausting for us. And so we know that trauma is real. And I just wanted to kind of throw this in here for you guys, is that we're seeing the life threats that are happening, the loss, it's creating a lot of inner conflict, and you're seeing that wear and tear on the healthcare workforce, and people are becoming baristas, right? We are losing our healthcare workforce, not due to aging as we thought it would happen, but we are losing them due to compassion fatigue. And we know it doesn't have to be that way, right? And so this is just a really nice graphic that I found in an AMA study on what we can do differently so that we're not experiencing the PTSD and the trauma that we know is coming for us when it all settles down and someday COVID goes away. We're going to have a major problem on our hands when it comes to PTSD for our healthcare workforce. And so if you're interested at all, I would encourage you to go read this study put out by the AMA called Caring for the Healthcare Workforce. And it just kind of outlines what we can do better for our healthcare workforce on the mental health side, right? And so just to finish up here, I want to point out that it's going to take all of us. It's going to take the time spent counseling patients on how important this is to actually listen to your healthcare providers, not only so that you can protect yourself, but to protect the healthcare workforce from burning out. So that's from the patient side. It's going to take administration holding us up and providing us the tools that we need to get to where we want to be so that we don't have to continue to live through this pandemic. And I just want to point out that for me, I think COVID really showed me, or really opened my eyes to what's important. And not that I didn't realize that my family was really important, but balance is really important. I cannot continue to burn the candle, as Sheila said, at both ends. And so what this taught me is that time is limited, right? You have to take care of yourself, as Sheila pointed out. And you have to do the things that are important to you now. They can't wait. And so I completely changed my career trajectory. And I think that that's really created a lot of happiness and helped me with my fatigue. So I just want to thank you guys for taking the time and listening today to a provider perspective, because I do think it's something that a lot of people don't get insight into. But I will say that the healthcare workforce, we are struggling. So kind of take us by the hand, give us a hug when you see us, thank us, because we're really trying hard, and it is appreciated whether you think so or not. So thank you.
Thank you so much, Dr. Florio, for sharing your perspectives and your knowledge. And I totally wish I could give you a hug right now. And thank you for not becoming a barista, because your patients need you. Next, we have Dr. Sabapathy, who is a clinical psychologist and director of medical staff well-being at Advent Health. Welcome, Dr. Sabapathy.
Thank you so much. I appreciate that. Yes, I'm Ravi Sabapathy, a medical psychologist over here at Advent Health. And Dr. Florio, thank you so much for your points and your meaningful conversation. I'd love to have a cup of coffee with you. I think if anybody's going to become a barista, she probably makes a really nice cup of coffee. So let's make sure we should all do this together. We should all be collaborating together and spending time together. This is the way that we're going to do it now. But I think even our area could really benefit from a wellness consortium. And this is essentially what we're kind of highlighting today. So thank you for giving me the opportunity to speak on this meaningful conversation. Yes, I've been with now Advent Health 20 years, medical psychologist, work in some different departments, bariatric surgery, pain management. About 7 years ago, I think we made a collaborative decision as an administration and medical staff to take wellness to a higher level. This was pre-pandemic because we saw what the literature was suggesting about the propensity and potential for burnout amongst really not just physicians, but what we know now is any healthcare worker. And so we've really expanded our program to address compassion fatigue and burnout, to highlight medical staff well-being and team member well-being. And so I'm going to spend some time talking about the health system perspective today. I'm sure there's been some amazing talks on this. I was in a little bit of patient service when the meeting started today, so I hope I can add to this really robust, informative meeting today. Let me share with you one of our foundations. If I may, I'll read it to you. I know you can read it. Please read it, but I want to read it with a little bit of mojo, if I may. This is the trust transformation for us at our hospital. I've been a part of building this phrase, but alongside others. So this isn't a Sabapathy quote. This is an Advent Health quote. If you want to accomplish more and improve outcomes in virtually every area of life and business, the goal is clear. Build better relationships. How do you do that? In a word, trust. Give others reasons to trust you and ensure your trust in others is valid. Relationships are the cornerstone to success in our personal and professional lives. They are the channel by which we accomplish great things and experience meaning, innovation, growth, change, restoration, transformation. All occur through trusted relationships. We don't succeed on our own, and neither does a business. So all of us are on this call today because we care about people. In some way, shape, or form, we care about people. I don't care who works in a hospital, no matter what they do, I think there's a sense of that person. So if we all come together, as Dr. Florio was saying, it takes a village. And so if we do this in a singular, segmented fashion of trying to address this epidemic during a pandemic known as burnout, compassion fatigue, we will fail. We will fail miserably. And the challenge we know through the data is we will fail in the worst way by losing people. I'm not just talking about burnout. September is Suicide Awareness Month. We will lose people to the greatest loss that we can potentially lose someone who essentially is healthy. That's why COVID has been so hard, because we've also lost healthy people. But we have to all work together. So I like this quote. If we're going to take care of patients in a whole way, let's take care of us in a whole way. But there has to be a bridge between what we do from a health system perspective, what we do on a healthcare worker side, or especially for me on a medical staff side, and an administrative side. We have to build these relationships. So I'm hearing a lot of stories today too. I think I'm going to continue the narrative, if you will. I don't have a bunch of quantitative data to pound on you today. I have some qualitative information, and this is a little bit of me. This is a little bit about me and what I think I've taken through the 7-8 years of being involved in this. So I have a breakdown for what I think trust is. And I think trust starts with transparency. And I know in a business capacity and setting that transparency probably can only go to a certain level. But I think transparency is a real important part of trust. Let me tell you what I think transparency is about. It's because we care, and I'll break down that acronym in a second. I'm a little bit of an acronym guy, but I think there's a way that we can really show care, and just the regular word of care. I'll break it down here in a moment. But it's not just about improving patient satisfaction scores and retention, right? It's about, really taking care of the human being, the human equation, as I'll often say. And that's how we can really build that sense of trust and build these relationships. So where I'm going with this is the health system perspective. I hope we can continue to be transparent about the things that we need to do and recognize the challenges of practicing medicine and caring for patients. I think of a health system perspective highlights the challenges of what medicine is, even pre-pandemic, we can definitely highlight it, especially during the pandemic. We're all talking more now, and that's good. I think there was, if you're a philosophical thinker to some degree, maybe this is happening for a bit of a reason to get us having meaningful conversations like this more so. But in the field of medicine, studying the burnout ratios, we realize that we shouldn't be having these conversations every day, all the time, pre-pandemic, as Dr. Florio highlighted some of the issues just before. So transparency is historically deemed as difficult in business and medicine, but I think that's when, if you come together and you come together with a shared experience, understanding that we all care about not having burned out doctors and compassion fatigued providers, and people that are on the brink of leaving their field. My goodness, how much time goes into this field? How much time goes into this study of medicine? So we really have that opportunity to really highlight this. Transparency to me creates a level of experience, of fairness and equality that reduces employee frustration. So I take this approach with you on a health system perspective. I'll talk to you more about what we're doing in our health system in a moment from a wellness perspective, but I think it starts a lot with this first part of the T, which is transparency. This is the care component I was talking about. We do some team care calls at our hospital. We started these with the pandemic. These go to everyone in our hospital. All you have to do is log on to a link that you get about a month in advance, and you're reminded about a week in advance and reminded again about a day in advance. But it starts with compassion, acceptance, respect, and empathy. And for time purposes, I won't go through each of these bullets, but there's a story behind each one of them. And the quick story is, from a health system perspective, are we showing care to the people that are doing the heavy lifting? Are we giving them a sense of compassion and highlighting the challenges for them? Sometimes I'll go over to the ED and just have some waters. I'll remind people to use the restroom. I'll, we have a little snack cart that we might roll around. These are all things people can get, but when you're grinding, you need a reminder. I hope you guys are going to watch the Chiefs game this weekend, and there's an important part of that team, and he or she doesn't get enough credit, and that's the water boy, right? But that is someone who's basically giving out water to someone who's so fatigued and they're just focused on their job, but they need that fluid to get through, essentially to stay safe. So we accept the challenges, we show as much respect and acknowledgement and care, and we try to empathize, because we can't necessarily walk in those shoes in that moment, but we certainly can show a lot of empathy and regard. And we can come back tomorrow, or someone maybe on our team, like me, because I can only be at so many places at once, right, can come back tomorrow representing what we're about and what we do. It helps people feel heard, valued, appreciated. What's the opposite of frustration to me? It's appreciation. So if we want to reduce compassion, fatigue, and frustration, the more appreciation that we show and share for others, especially the people doing the heavy lifting, will be important. For time purposes, I'm going to move a little more efficiently here, but rapport. We want to make sure that we can build a sense of rapport, a connection and a relationship with another individual, to kind of create that sense of understanding. And again, we're really trying to build a bridge, like I mentioned before. You just can't have trust without rapport, without building a sense of, I got your back and you got my back. And I think that's so important. Understanding. I think the bullet point I want to highlight here is, do you consider burnout and compassion fatigue when looking at numbers and productivity satisfaction scores? So if I'm someone that wants to be a compassionate administrator to my compassionate providers, and knowing that they have compassion fatigue, am I taking that into consideration? Or am I intervening early? Am I seeing a picture start to develop that is indicating that someone is tired and worn down? I think I don't even know if you have to look hard enough. I think if you just look, you can start to see it before. Now, I will tell you, doing this type of work for 7-8 years, it's not the easiest thing to see. There's a lot of people that put a smile on their face like you and I and say everything's fine. Well, one of our campaigns in the hospital is we say, it's okay to not be okay. For me, I say it's okay to not be okay. It's just not okay to stay that way. So we have to do things to build that sense of understanding and appreciate the challenges that our people are going through. And again, have historically been going through. Empirical evidence backs that. Do people feel safe and secure to have conversations? Can I walk into an office and talk to my manager about my struggles, that I'm not sure that I can continue to do this? Can we have these secure places for safe conversations? Safety builds a sense of appreciation. Do I feel safe to have these conversations about my challenges, as I mentioned? If you do anything here, just do something, right? Do something that demonstrates a recognition for the challenge. A health system perspective will be so valued when you do that. Now, we have to understand that health systems are in tough spots too. How do we make sure we can maintain our budgets and maintain the things that we need to do to run a successful organization, hospital, business? So we on the medical staff side and the healthcare worker side, I think that needs to be an understanding as well. It's kind of like dealing with insurance, right? I mean, I don't think we necessarily get upset with, any entity, but a lot of times we have administration and we have physicians, and we're all trying to work with the guidelines of the insurance company. So that's where we can, I feel is a good example where we can come together with this sense of how do we figure this out? How do we crack this nut? Cracking this nut means we're going to try to transform something, and we must have some transformation right now. Our people need us. Later this afternoon, I'll be rounding on our people and checking on them before the weekend and finding out who's on call, who's not. What text messages can I be sending? A quick text message on a certain time can go a long way. I think people recognize that. So we're really trying to transform, and the way that you transform something is through trust. You try to work on building that trust. Do your doctors and staff, do they feel valued? Do they recognize that do they feel like they matter? Do they feel like they're important enough? Or do they feel like they're just a part of the growth perspectives and the margins? I think it's important for them to feel that sense of value. This is a quick slide that just highlights some of the things that we're addressing. I call it Beyond Burnout. These are real people dealing with real issues. And I think it's important to see this slide and recognize that our people don't just get tired. They deal with any issue that you and I would deal with. The added stress, the potential increase of divorce rates and family issues. And unfortunately, new literature is saying that we're losing about a doc a day. There's 365 days in a year, and we're losing about a doc a day to suicide. So if you do anything, build awareness, build recognition, have people in your organizations to talk about these things, have a voice that respects the silent pride, if you will, of I got this, I'm doing okay. And I'm not asking you to push people when they say they're doing okay, but just check on them, see how they're doing. This slide is, I think, important. It talks about maybe some of the challenges that we face, that we faced historically. I come from a medical family. I've heard about some of the challenges amongst medical staff and administration for many, many years. But I actually think there's ways to bridge this gap. But here's some things that highlight some characteristics, if you will, why maybe there's some challenges here. The physician is hardworking, one of the hardest working people I know. In the medical practice, there's always work to be done. In a hospital, there's always work to be done. During a pandemic, during a staff shortage, there's always work to be done. Physicians are performance driven. There's always a pressure to perform at such a high level. The margins in healthcare are almost none. The margin for errors in healthcare is almost none. Physicians strive for the best outcomes. Medicine is a world, that will have some difficult outcomes. Who's going to be there for that person when those things happen? I like this one. The physician likes to be in control, but so does the practice to some degree. I mean, this is where it's a kind of a battle of the wills. But listen, we can all take turns driving the bus to some degree, but we can also respect what each person's specialty is. And if the person's specialty is on the financial side and the person's specialty is on the clinical side, how do we have meaningful conversations? How do we have a turkey sandwich together and sit down and talk about that? before the big issues can arise and make more challenges. Physicians appreciate consistency. Practices are always changing. Physicians are caring. There's so many to care for. I'll often say so much for so many for so long. And you can add more words to that during a pandemic. So much more for so many more for so long. Physicians are precise. We talked about those small margins. Physicians are very diverse people. They're broad. They have a lot of interests, actually. As Dr. Florio said, time and energy so consumed by the practice of medicine. And physicians inherently, historically, it's changing a little bit, may have some limited business training, and a medical practice does require proper business management. So when I show this slide, I think a lot of people will step back and say, yeah, we can work with this, and we can find ways to find, again, that common ground, bringing and bridging the aspects of administration and medical staff all together for the common goal of serving and caring for not just our patient, but for our provider that the empirical evidence suggests are struggling at a tremendously high rate. One more minute here. This is essentially what we're doing here. Everybody has to do what they can do, right? Everybody is maybe budgeted a bit different for this, but I think everybody here, I'm confident, has a vested interest in the people. I don't think you'd be at this meeting if you weren't. Sometimes we have to destigmatize and normalize the process of well-being to get people to initiate it. A quick story. When I first started, we used an EAP program, an employee assistance program. You'd call somebody up and say, hey, I got an issue. And that utilization real quickly was 0%. Zero. We're putting dollars and monies into a program that's not getting any type of ROI. And so with the blessings of so many, I've had an opportunity to have 150 physicians come in for counseling, coaching, consulting over the past few years. We got more to do though. I'm proud of that, but we got more to do. The rounding, like I'm going to do later today, we're just going to check on people. We're not doing rocket science here. We're not building something for NASA here, but we are trying to relate. And I will ask someone what they do later today. And like Dr. Florio, I'd ask, hey, Dr. Florio, what are you going to do with your kid this weekend? And I'd really want to know. And I think she'd know I'd really want to know. We do departmental talks. We're trying to build outreach, education, awareness. I do a little blog. I've been doing some video blogs too, not my thing always, but as I speak on these kind of settings, I get a little more comfortable. So just trying to reach out to people in different ways. The team care calls, as I mentioned. We do new provider orientations. If you join the system, you'll meet me basically, and I'll talk about well-being and how it's valuable and important to us. Finding Meaning in Medicine is a group amongst physicians that I co-lead with another physician that really gets people, doctors together. We might break bread together, share a story together. We have usually a topic that's of meaning specifically to physicians. And it actually can elicit some emotion. It's a confidential meeting. But that's been going on for a few years in our hospital. I wasn't sure if that was going to have the traction, but doctors have found the time, believe it or not, to come in for those evening suppers and meetings. We do some support meetings. We're really trying to do things to have intentional recovery, especially right now. We might open up one of our large conference rooms and highlight that we're going to be there if people want to come in to debrief and just talk about their day. And so these are some of the things I do. It's confidential, the things that I do. We focus on trying to make sure people know that I'm available. And this is a team. It takes a village. I won't go through all of this for time, but you see that you have people from all different angles. Listen, the well-being specialist in a system, a health system, can help make some change. But that change is only going to go so far as how far the team lets us go. We're going to watch Patrick Mahomes as a quarterback hopefully do well on Sunday, but there's 52 other guys on that team that are going to really try to help them be successful. And so it takes a village here too. As I close with you today, I just want to highlight the challenges that we've all been through, the stories that I hear. They're very real, and it's very significant. I'm seeing more doctors now than ever, more physicians now, more medical staff folks. We're starting to take care of our team members. I oversee team member well-being with a licensed clinical social worker on our staff. And so I want to thank you for allowing me to talk about this important conversation with such amazing people and amazing people that are listening. So thank you.
Thank you so much, Dr. Sabapathy. Excellent points and some really great takeaways on how we can start to encourage well-being initiatives in our own employment areas. And one thing that I really want to stress that I know a lot of our speakers have alluded to is that while we focus a lot on clinician and provider burnout and fatigue, I think, you know, as Dr. Sabapathy and Dr. Florio mentioned, healthcare really is a team effort, and our kind of other service providers, our environmental services folks, our food service folks are also feeling the strain and stress of working in a pandemic. They're also facing employment shortages, and it's important to realize that as we walk through the hallways of our different employment venues to take the time and say thank you. And hopefully, as Melody expressed, that they live in those moments and sit in those thank yous. Next, I have the pleasure of introducing Dr. Stacy Farr. She is a research assistant professor at the University of Missouri, Kansas City, and also is the director of the cardiovascular outcomes division at St. Luke's Hospital. She herself is a working mother and also has to deal with managing a very large team of individuals and having to manage potential burnout and fatigue in her role as a manager. So she will be facilitating a brief question and discussion session. Welcome, Dr. Farr.
Oh, thank you, Christina. That was such a nice introduction. It's so funny. I was just texting and emailing with some people. My kindergartner is having a very hard time transitioning to kindergarten, and thus I am very sleep deprived today. So, this talk has resonated so well with my own personal life. So, thanks for that acknowledgement. And thank you to all the speakers. I think I didn't see a lot of discussions going on in the chat, but I would like to also, open this up to be a lot more interactive. So if there's, anyone on the call that has any questions or comments that they would like to share with our speakers, we would be, more than happy to have you, share your video, unmute yourself, and speak directly to our panelists and speakers today. And while people are gathering their ideas and questions, one that I had, I really loved hearing, we've had multiple providers speaking, researchers, and long-term care perspective as well. And so I think what would be, what I would like to hear even is from hearing a lot of the strategies that Advent has put into place under Dr. Sabapathy's, leadership. I would really love to hear any reactions from anyone else in other health systems that, and what their experiences are, or what their hospitals or healthcare settings are also providing to providers, and how, what things they can learn from what was done at Advent, or what the things are similar. I think just sharing across those institutions would be helpful. So I don't know if any of our two speakers would like to share from either the Children's or the St. Luke side, or anyone else on the call.
I can share. Our at Children's Mercy, our physician wellness program, I think, has been, it's not just physician, I'm sorry. It's really a wellness program geared towards everybody at the hospital. And I think they've worked really hard at addressing how do folks find balance. I think one of the things I've noticed that's hard is, as Dr. Sabapathy said, you've got these opportunities, and sometimes they have an opportunity in the evening, and then I have to decide, do I go to that event, which I know is going to be great, and I'm going to connect with other faculty, which I really missed during a lot of this distancing during the pandemic, or go to my son's volleyball game, and talk to the parents there. And so that, I think, is a continual struggle for organizations to find ways to create space for it, so it doesn't feel like another thing on your list to do, but actually feels integrated into the work. And I know for me, like in the Eating Disorder Center, we have a staff thing twice a week. We used to sit in a conference room and eat our lunches and review cases for an hour and a half. And it was a lot of work, but also a lot of great social interaction. And I didn't realize that part of it until we had to do it on a Teams meeting. And it's very different because there's concern about talking over each other and who wants to eat right in front of the camera, right? That feels awkward. So it changes things. So I think we just have to keep adjusting with it. But another big thing I think Children's has done that I have valued, and I think a lot of our nursing staff and physicians have valued, is that they did a survey. We started noticing we were having such an influx of patients with behavioral health problems. And we are not a psychiatric hospital, but we have so many patients present for those needs. And with COVID, a lot of psychiatric hospitals are at half capacity. So we are seeing this huge influx of patients that have nowhere to go, many of which can be violent and difficult to manage if you don't have a background in how to help them. And so they did a big survey to really hear from the staff, how do you feel about this? And boy, did hundreds of people fill out the survey. And then they've made a lot of changes in response to that. So I think a part of it is really going to the staff and saying, what do you need? What are the problems that you're seeing? How is this difficult for you? And going for it, because sometimes it's hard to know what people need. And I think, like Dr. Sabapathy said too, that connection, just talking to people sometimes is really what's going to help you figure out what they need.
Yeah, thank you. Are there any other, I don't know if Dr. Florio, you'd like to share your perspective on what's being done at St. Luke's, or if there are any other, I'm kind of scrolling through the speakers now to see if there are any other healthcare providers on here that would like to speak about what their
Sure, I can
organizations
speak,
do.
Casey. I think that from my perspective, what is really important is, Sheila, you touched on this, and I think it's so important for administration to understand that we are humans outside of those walls. We have families, we have commitments, and things that make us happy, right? So I think that one of the things that we really struggled with is getting our administrators to understand that meetings after hours aren't a mandatory thing. Like, you can ask people, but to blatantly put things on people's schedules and then they just pop in and it's after hours is really a form of disrespect, right? So I think if you want to show your employees, and not just as Dr. Sabapathy pointed out, it's not just providers. It's, our front desk staff, it's our MAs, it's our nurses. If you want to show them that you care for them and you respect them, then you respect their time, right? And so to have meetings that are mandatory during the working hour is more respectful. So like at the noon hour, or block off the end of the schedule and make sure that those are done at the end of the day, I think is really helpful and really shows that you value your team as human beings, right? So I think for us, that was a big turning point during COVID, is to make sure that those things happen during working hours so that we could go home and kind of decompress with our families. And that was really hard because I know I come from a 2-physician household and we're both obstetricians. And so our decompression was like talking about what happened during the workday. And so to get out of that and to have people outside of that world are really important. And I'll share with you guys, Christina is actually one of my good buddies. And so one of the things that has been really helpful for me is to just sit down and talk with my girlfriends that aren't an obstetrician and just kind of decompress that way, because you need that social interaction outside of medicine. Because for months on end, you sat inside the walls of your house and then you went to work, right? My son said the other day his favorite birthday was when my mom circled the cul-de-sac with balloons. And that was, like, to me, the worst birthday ever because nobody could spend time with him. But I think that most important for me is you want to feel valued. And there are certain things that your healthcare infrastructure and administration can do that really make you feel valued. And they're not that big of a deal, right? Like to have those moments during the day where you can either decompress or to have those required meetings during that time makes you feel like, okay, they value my time outside of here. That's good. I want to keep working for them. And so I think that that's a really important thing to point out.
I can make, go ahead.
Oh, no, definitely. Go ahead.
I just want to make a quick comment about the time issue. I think this will highlight exactly what the doctors mentioned, and that is the teen care call that we did. We wanted to kind of respect people's time, and so we actually did it at 5 o'clock initially, and we got like 20, 25 people attend, and we're like, okay, this is pretty good. But now we shifted at noon, and I think the last one was 175. And again, now that's tricky, right? That's tricky to do that because we've got to, it really has to be that sense of, okay, administration, medical staff, a whole hospital working together. But once a month, we're trying to do these and just look at the return on that in terms of respecting people's time and respecting. So we try to be mindful of that initially and say, okay, well, we can be there for you towards the end of the day. You know where people sometimes want to be at the end of the day? In their car, driving home, getting ready to be with their family, going to the soccer thing. I watched my daughter play tennis yesterday. That was really important to me to get over there and be there to support. Because you know what? Dr. Florio said value. I value her. I value my family. I value my kids. I value you guys. And so we have to show value to them by showing value to their time and their energy.
Well, thank you. This has been such a great session. And I guess on the theme of respecting everyone's time, I also want to realize that we are a little bit over time. So I just want to thank everyone and know, and I guess to conclude, I would like to also say that, I think what this has shown, and I'm really honestly grateful for everyone kind of saying this message, but the whole normalizing of this, I do think is really important. And especially when you put it in the context of how the US is compared to a lot of other countries, in terms of balances and, this extends into, different aspects and different policies, right? Like, family leave and things of that nature. And so I think just being mindful of that and the need that we have, not only in Kansas City, where the main audience is for this forum, but, in the entire US, just how important it is that we continue to make strides toward making that normal, that we all, strive for balance so people can be happier and less fatigued. So thank you all. This is a really great panel, and we look forward to seeing everyone at the next KCQVIC forum, which is October 21st from 3 to 4:30, and that's on novel approaches to social determinants of health. And again, also, these are also recorded on our website. So if anyone wants to see these after the fact, they'll be up in a few days on our website. So thank you all. Happy Friday.
Thank you, Stacy. Thank you, everyone.